At this moment we know that MRD is a very important prognostic marker, but we still have to learn about the value of MRD in decision making, stopping treatment in patients that have sustained MRD negativity, or continuing treatment, or adding new compounds in patients that remain MRD positive to try to convert them to MRD negativity. And those questions are currently being evaluated in different trials, so we have to learn more about this. And probably already in the current trials, we are measuring MRD negativity after induction, after transplant, after consolidation, during maintenance, and treatment decisions are currently being evaluated based on these measurements. So stopping treatment after sustained MRD negativity. So MRD negativity at least 1 year apart.